The science of preparing and dispensing these medicines and drugs is called pharmacy. And the key figure in this profession is the highly trained, registered pharmacist. He may be the man working diligently.
Okay, so a couple of things. First, women can obviously be pharmacists too, something not as common when this film was produced in 1946. Second, some would argue that the key figure in preparing medicines is not, in fact, the pharmacist, but the pharmacy technicians.
Next to every outstanding pharmacist, there's an outstanding pharmacy technician. Pharmacy technicians have a unique skill and ability to get patient care delivered every single day.
So how many of these do you make a day?
I make about, you can make up to 150, 200.
Wow.
It's fun.
It's fun.
It's really fun because you're helping the patients, so.
Melinda works as a pharmacy technician at Memorial Hospital in Belleville. But out of patient privacy and sanitary precautions, we opted to show how Melinda does her job at Southwestern Illinois College's pharmacy lab, which was where Melinda received her certification.
I wanted to go to the nursing program at SWIC. However, after working in the hospital and watching what the nurses do, I didn't want to become a nurse anymore because I don't want to have direct care with patients. So in the pharmacy, I really can still help the patients. I'm just not direct care.
Prior to starting the program at SWIC, Melinda was already working as a pharmacy technician. But while you can start the job without any special credentials, training and certification is required within the first 2 years of employment. Of course, rules and regulations change from state to state, but Illinois is anticipating that in 2024, all technicians will be required to take a class and pass the pharmacy technician certification exam before becoming eligible for employment. This doesn't seem to be the case for Missouri quite yet, but the benefit of having this certification is the ability to work in any state and more potential for career advancement. Not to mention a deeper understanding of the work.
Last night homework assignment was the drip rates and flow rates. You all are quiet. I'm assuming it wasn't an issue. All right, let's do it then. Let's go to number 1.
The Pharmacy Tech program at SWIC is the first in the St. Louis region that has been certified by the American Society of Health System Pharmacists, which, according to Dr. Ryan Burke, who started the program,
That's a big deal because it provides high quality education at an affordable cost.
It's also a big deal given that the program has only been around since 2021. Dr. Burke saw the need for the program in preparation for the new Illinois training requirements and, no shocker here, the desperate need for more healthcare workers.
So we have a shortage of technicians. We also have medication shortages, which requires more manipulation and more labor, more technicians to do that work. And that shortage of technician I felt was from not having enough exposure for individuals coming out of high school or the community in general, this is an access point to a career in healthcare.
Depending on the setting, technicians can play various roles within pharmacies. So there are the drugstores, which are pretty straightforward in assisting the pharmacist in filling prescriptions. But in a hospital, there are expanded opportunities, such as the ordering of drugs, medicine recommendations for patients, and a newer practice called drug diversion, which is the effort to reduce the illegal distribution and abuse of prescription drugs.
And so those are expanded roles that we're really excited about, that we continue to have the SWIC program develop individuals and get exposure to that, and then we develop them from that on.
And in cases like Melinda, where she was already working at Memorial Hospital, she qualified for the apprenticeship program, so they not only covered the tuition, but she was compensated for her time.
Yeah.
So you were paid
To go to class.
to go to school.
Mm-hmm.
I mean, that's the dream, right?
Mm-hmm.
So no student debt,
No.
and now you're working full time.
Yeah.
In the program so far, we've had every type of student. We have had some 17-year-olds come, and then I also had a 50-year-old student, And I've also had a 63-year-old student who just finished in December.
Melissa Epps is SWIC's Pharmacy Technician Program Coordinator and has been a practicing registered pharmacist for the past 25 years.
There is tremendous changes, especially when it comes to the use of pharmacy technicians. Before I went to pharmacy school, I was a pharmacy technician, and basically we just answered the phone and helped with the pharmacist, like counting the medication and entering it into the computer. But now pharmacy role has greatly increased for pharmacy technicians. And also with COVID, technicians became certified vaccinators.
Another change that Melissa has seen, salary increases. And as job vacancies continue to grow, she expects the pay rates will increase as well.
All the instructors with the program are very dedicated to helping the students pass the program. And that's one thing that's very unique about going to a program at a community college, because you have all these resources to help you be successful.
Pharmacy technicians are essential to the healthcare that we have in this country. I think they're the unsung hero many times. They work side by pharmacists to just take care of patients. And I think it's a wonderful career, and I hope more people look into it.
For Living St. Louis, I'm Brooke Butler.